Have you ever felt your heart suddenly start racing, fluttering, or beating in a completely irregular pattern and wondered whether something was seriously wrong? That feeling could be atrial fibrillation, and in this video I'm going to explain exactly what it is, why it happens, and what it actually feels like. If it's your first time here on my channel, welcome. My name is Hafiz and I'm a cardiologist based in London. I create videos to help you to keep your heart healthy and explain heart conditions in a way that I hope is easy to understand. If that interests you, then click on the subscribe button and bell icon so you get notified every time I release a video. Atrial fibrillation, or AFib, is a condition where the top chambers of your heart, called the atria, fire off chaotic, disorganized electrical signals instead of the usual smooth, coordinated rhythm. The result is an irregular and sometimes very rapid heartbeat. In this video, I want to focus specifically on the patient experience, what AFib actually feels like, because I think that's the most important starting point for understanding whether you might have it. So let's start with the most common feelings. The number one description I hear from patients is a fluttering feeling in the chest. Others describe it as their heart jumping, doing somersaults, or skipping beats. Some patients tell me it feels like a racing sensation, like their heart is running when it should be walking. Now, technically, the heart isn't skipping beats. What's happening is that the atria are firing in a chaotic, disorganized way, and the ventricles, the lower chambers of your heart, are responding irregularly. So instead of a steady, predictable rhythm, you get this irregular pumping, which you feel as those flutters or thumps. Another very common description is a pounding sensation, particularly after what feels like a brief pause. The heart fires irregularly, there's a gap, and then you feel a stronger than normal beat. That's actually quite characteristic of AFib. And importantly, some people feel nothing at all. This is called asymptomatic AFib, and it's one of the reasons AFib is sometimes missed for years. We might only pick it up on a routine ECG or when a patient is being investigated for something else entirely. So to summarize the most common symptoms, I usually describe three main ones to my patients. The first is palpitations, that fluttering, racing, or irregular heartbeat felt in the chest, throat, or sometimes the neck. The second is breathlessness. Because the heart isn't pumping as efficiently during AFib, some patients feel short of breath, even at rest or with very minimal activity. This can be quite alarming if it comes on suddenly. And the third is fatigue and lightheadedness. Some patients feel drained, dizzy, or faint during an episode. This is because during AFib, your heart's output drops. It's not delivering blood around the body as effectively as it would normally. And so you feel that as tiredness or a feeling of being unsteady. Now here's something important I want to explain, because not all AFib feels the same, and a lot of that comes down to what type you have. There are three main types. Paroxysmal AFib, this comes and goes on its own. Episodes may last a few minutes, a few hours, or even a couple of days, and then the heart returns to its normal rhythm without any treatment. Patients with paroxysmal AFib often know exactly when an episode starts and when it ends. Persistent AFib, this lasts longer than 7 days and doesn't resolve on its own. It requires intervention, either medication or a procedure to restore normal rhythm. And then there's permanent AFib, where the heart remains in AFib continuously. Why does this matter? Because patients with paroxysmal AFib are usually very aware of their episodes, but patients with persistent or permanent AFib can sometimes adapt to the feeling over time. They stop noticing it. And as a cardiologist, that actually concerns me, because AFib carries a real and significant risk of stroke, even when you feel completely fine. If you want to understand more about how AFib is diagnosed and treated, I've done a full separate video on that, and I'll link it on the screen now. So when should you actually seek medical attention? If you experience a sudden onset of palpitations, breathlessness, dizziness, or chest discomfort that doesn't settle within a few minutes, seek help. Your GP or your local emergency department can do a simple ECG, which may capture the irregular rhythm if it's still present when you arrive. If episodes are brief but recurring, even if they resolve on their own, please tell your doctor. A 24-hour Holter monitor or a wearable ECG device can capture your heart rhythm over time and help us make a diagnosis. And please don't dismiss repeated palpitations just because they go away on their own. Paroxysmal afib that resolves spontaneously is still afib, and it still needs to be assessed and managed. So just to recap, atrial fibrillation most commonly feels like a fluttering, racing, or irregular heartbeat, sometimes with breathlessness, lightheadedness, or fatigue. But some people experience no symptoms at all. The key message is this: if you think you might be experiencing these symptoms, even intermittently, please speak to your doctor. Have you ever been told you have AFib? Or do you think you may have experienced an episode? Let me know in the comments below. I'd love to hear from you. I hope that was helpful, and thanks for watching.